Well, good afternoon, everyone. I have a lot of important information to tell you today, and I am therefore grateful that you have taken the time to join us. You will, I am sure, have seen or heard about the United Kingdom Prime Minister's briefing last night. He painted a bleak picture of the situation. The NHS in the UK is under considerable pressure. Each of the nations of the United Kingdom is now. Today, the United Kingdom recorded a record-breaking number of daily COVID cases, 61,000 people. The situation here on the island is evolving quickly. I briefed you on Sunday about some cases that had slipped through our measures and told you what we were doing about it. I'm afraid that I now need to brief you on further concerns we now have in relation to our island's community. It follows 6 positive test results that emerged late yesterday and overnight. We have also had 1 new positive result this afternoon. The positive results are from a mixture of circumstances, although at the moment there is no indication of any link to the 2 cases announced on New Year's Eve. The Council of Ministers held an emergency meeting this morning and agreed a number of measures on which I need to update you. None of this will be easy to hear. There remains a deal of unknowns, and I will be as frank with you as I possibly can be, within, of course, the important constraints of personal confidentiality. I'm joined today by the Minister for Health and Social Care and our Director of Public Health, Dr. Henrietta Ewart. I need to start by telling you that we now have evidence of further spread of infection to others from an index case associated with travel. We now have confirmed cases of COVID-19 beyond the household of the traveller, and these cases are associated with a number of different locations involving potential contact with a large number of people. This gives us a significant risk of reseeding widespread community transmission. We have not yet seen this spread widely into the community, but there is a credible risk that this will happen in the coming days. There is no reason to panic, but there is a need to act decisively. As always, our primary objective is to preserve life. This was, of course, foremost in the minds of ministers when we met this morning and again this afternoon. In addition, we now have a new imperative to protect our vaccination programme. We have to ensure that the plan we have in place to protect our people, starting with our care workers and our most vulnerable, is in no way put at risk. Now, before I tell you the measures that ministers have agreed to put in place to deal with this new situation, I would like to invite the Director of Public Health to brief you on the latest situation from a contact tracing point of view. Henrietta.
Thank you, Chief Minister. And the reason we have particular concerns about the potential for community spread resulting from the cases that were identified last night is that overall the cases have a very large number of potential close contacts, and those contacts are spread over a number of locations. So we have to say at the moment that we haven't been able to assure ourselves that we have closed every single potential transmission chain there from the people that were contacts, checking them to see whether they are positive, getting them in self-isolation, but then actively seeking cases wider in their contacts where that's indicated. And clearly that is a large job given the number of contacts involved, and it will take time, and there is always the risk that while our contact tracers are doing it, there is the opportunity for further transmission. That's why we'll be putting out some very clear messages about people or groups of people that we would like to get into self-isolation and then call 111 so that we can try and close down these lines of transmission before they do spread further. Thank you.
Thank you very much, Henrietta. Now, it's worth clarifying at this point that we do not yet know whether the cases we are seeing are of the new variant that we have been hearing so much about. We should know more about this in the coming days, but as you would expect, we have based our response on the possibility that it is indeed the new highly transmissible variant. it is right that we plan for the worst case scenario. There are other important pieces of context. The current vacant bed capacity at the hospital is low. This is, of course, not unusual for this time of the year, but it is important we understand this. Also, as in the spring, we cannot depend on our friends in NHS England for any resilience. They have their own challenges. The Council of Ministers has decided to maintain our overall objective of local elimination, and this has shaped our decision making. Given what we understand about the new variant and the context we find ourselves in, we have therefore had to be bold in our actions. The Council of Ministers has agreed to adopt a circuit break approach. Now, I know that this has had mixed success across in the UK, but our starting point is different. This means we will have to go in hard and fast. This is the approach that worked well for us last spring. The Council of Ministers has today agreed that the following measures will come into effect as soon as possible. All of the following measures must be in place no later than from 1 minute past midnight Wednesday night into Thursday morning. To be clear, that is just over 24 hours from now. But if people can put these measures in place sooner than that, even better. The overarching and most important point is that we will need everyone to stay at home as much as possible. We will require the return to social distancing of 2 metres everywhere outside the home. You will not be able to gather with anyone who is not a member of your household. You will be able to go outside for exercise once a day. We will not limit how long for, but it can only be with people from your immediate household. We would ask you to do your best to avoid any crowded area, and you must wear a face covering. Weddings and collective worship will not be able to take place. Funerals may continue indoors and outdoors only with a maximum of 10 people, with social distancing and the use of face coverings in place. We will be asking everyone who can work from home to do so by Thursday, and ideally, if possible, before. We will require all employers to take this obligation seriously and do everything they can to facilitate. We know that some companies will need to have a skeleton team in place to ensure core services, but this must be kept to an absolute minimum. The construction sector will have to stop work except for emergency work and essential repairs. The manufacturing sector can continue to work if and only if it can do so with social distancing and other measures in place. There will be an orderly closure of schools and nurseries as we re-establish the hub system we had in place before to cater for children of essential workers and any vulnerable children. We expect this to be in place by Thursday and certainly before the end of the week. Head teachers will be in touch in the meantime with immediate effect. School attendance will not be compulsory. All hospitality venues will have to close as soon as possible, but no later than 1 minute past midnight Wednesday night to Thursday morning. This includes all licensed premises, all cafes, restaurants, bars, pubs and clubs. The only exception to this will be for takeaway or delivery food and alcohol only, no eating in. All non-essential shops will have to close from the same time. For most, this will undoubtedly mean an end at the end of business tomorrow. Only food shops and pharmacies are considered essential. We have, however, agreed that for the moment at least, hardware and garden centres can also remain open. On supermarkets and food shopping, please shop responsibly. Although the measures being introduced here today haven't applied to us for the last 6 months, remember the United Kingdom has been in varying degrees of this situation for many, many months, and their supply chains are stable. When you go shopping, please minimise numbers. It should be one person or one person and a child, only if you're a single parent. Please do be considerate and leave supplies for others. there is absolutely no need to stock up. Our freight continues to flow, and you will recall that there were no problems with supply in the spring during lockdown. All lifestyle businesses, you will remember that this is broadly hair and beauty businesses, will have to close. Face coverings will be compulsory on all public transport. We have also recommended to taxi operators that they should not pick people up unless they are wearing face coverings. In addition, we strongly advise face coverings to be used by everyone anywhere outside your home when you will be in close proximity with others. All indoor leisure facilities will close. This includes gyms and swimming pools. At this stage, we will not be putting in place an all-island speed limit as we did last year, but we would ask everyone to drive carefully and bear in mind the pressure any incidents may have on the hospital, and we will revisit this if necessary. With immediate effect, we are asking those at significant clinical risk, those who shielded before, to do so again for an initial period of 1 week, and then we will review and be in touch. We will be ramping up our support for vulnerable people who will need assistance with shopping. We have asked all care homes to stop visits with immediate effect. This will be for an initial period of 1 week whilst we evaluate the situation further. We are moving to level 5 of our borders framework. We strongly discourage any travel off island. If people do decide to travel after tonight, we cannot guarantee when they will be able to return. Those who do return from 1 minute past midnight, Wednesday night to Thursday morning, again just to be clear, in just over 30 hours' time, will require to undergo a new testing regime. This will be 3 tests, one on day 1, another on day 6 or 7, a third test on day 13. Those returning will have to pay £50 for each test. If people are not prepared to do this, they will have to self-isolate for 21 days, and obviously patient transfers are exempt from this. Returnees will no longer be able to self-isolate with anyone other than those they have travelled with. There will be no financial support for any returnees. There will be some changes to our wider healthcare provisions, as you would expect, and I would like to invite the Health and Social Care Minister to brief you on this. David.
Thank you, Chief Minister. As the Chief Minister has already touched on in his speech, it is important, particularly with the winter pressures, that we preserve bed capacity at Nobles. Therefore, the decision has been made to cancel elective surgery for the next 2 days, at which point we will review where we are in the bed situation and make a further decision at that point in time. Again, as the Chief Minister has already advised in relation to shielding, we will be advising anyone who has previously been in receipt of a shielding letter to shield for the next week, and again we will be reviewing it after 7 days. In relation to patient transfers, these are continuing into the UK, where hospital capacity allows in the UK, but we will be looking through the patient transfer list to ensure that we are sending people appropriately, and those that do not need to travel, we will look to what alternative arrangements can be put in place. In relation to personal protective equipment, our protocols around PPE in the hospital and across our estates are being reactivated. So there will be PPE requirements within the hospital. Equally, we will be advising in care home settings that the PPE requirements that were in place during the pandemic are reintroduced. Care homes and residential homes, as the Chief Minister has touched on as well, our advice to them is to close for visits for the next week, and at that point, after 7 days, again, we will review that advice and issue further advice at that point. In terms of our own visiting policies within DHSC, there will be minimal visiting enacted, where visiting will not take place unless it's in compassionate grounds such as end of life. We need to also protect any what we would refer to as front door entry points into the hospital. So we will be continuing for anyone who does enter to keep contact details, and I know it will probably be a question around the vaccination programme that is now going on, because that sees a large footfall. We will be introducing similar protocols to those that are in place in the UK, so there will be social distancing employed where possible, there will be PPE in full use, and people will be kept in different areas as they go through the vaccination programme. Thank you, Chief Minister.
And thank you very much, David, for that update. Now, we are unlikely to know for the full extent of any community spread for maybe 2 weeks. We are putting these measures in place for an initial period of 21 days. As I've said before, this period starts from 1 minute past midnight Wednesday night to Thursday morning. I hope that it will end on Wednesday, the 27th of January. Within that period, we will, of course, regularly review, and I will keep you updated as often as possible. We will be returning back, we will be turning back on some financial packages. The salary support and MIRA, or Manx Earnings Replacement Allowance, will return for this initial 3-week period. I know that these measures may appear severe to some, but ministers today agreed that we needed to take decisive and bold action without delay, to protect what we have achieved already, and importantly, to protect our vaccination programme. There is no need to panic, but neither can we afford to delay. I know that there will be lots of questions, and we will need to provide more detail. I will do my best to answer questions now, and the team is working away this evening to get additional details available on our website. To remind everyone, that is gov.im/COVID-19. From 8 o'clock tomorrow morning, the COVID community line will be up and running again, and I know that this was a big help last time. The number is 686 262. I'll say that again, 686 262 for any non-medical queries. Now, of course, if you show any symptoms, then you need to stay at home and call 111 immediately. But please do not call 111 with general inquiries. We need to let these people do their job. But the broad parameters are clear. Stay at home if you can. If you can't, then ensure you do everything in your power to be safe. Remember the basics that you did so well in the spring. Wash hands, keep distance, and this time we are going to ask you to use face coverings as much as possible. I will pause now and take questions from the media. And first we have is Dewan Turner from Energy FM. Good afternoon, Dewan. Fast am I.
Fast am I, Chief Minister. Thank you very much. A lot of information there. It's obviously going to take quite a while to digest it all. Most of it is things that we were used to dealing with last time we had this. Can I just start by asking about yesterday when we were talking with Minister Ashford about the fact that some of these people had tested positive after the 14-day isolation period. As this goes on and develops then, would you be considering, once things do start to move again, that isolation period is now increased, given that you've had more than one case which has shown symptoms after a 14-day period?
Well, June, we've already put in measures in place from the 23rd of December. We brought in new measures that returning residents had to be tested on day 1 and day 13 before they were allowed to exit from quarantine on the 14th day. Now, since that, we have now brought in a further test on day 6 or 7, so that will be 3 consecutive tests before you're allowed to vacate, and that will ensure that we pick up if you've maybe had COVID in the middle of that period of time but have recovered and therefore given a negative test on day 13. So that is designed to ensure that all returning residents now will be, we will reduce the likelihood of this happening again. Now, with COVID, you can never say never, but these 3 tests, our experts tell us, are the best way to ensure that we protect the island going forward. And as I say, we had already put this in place prior to these unfortunate outbreaks, but it happened just before the people that have developed it had arrived back on the island before we implemented this measure. I don't know, David, if you want to add anything to that.
Yes, so the day 1 and day 13 test that was brought in is exactly designed to try and deal with this. As the Chief Minister said, with COVID, you are never going to be able to say never. There is always a residue risk. The residual risk with people past day 13 who might pass a test but then go on to develop COVID-19 is less than 1%. So it is low. We have to remember with these cases, because that testing regime was in place, we don't know if the individuals would have passed a day 13 test or the day 13 test would have picked it up. The likelihood is, on the law of averages, that the day 13 test would have picked it up and would have said that they were positive, because there is only a residual risk of just under 1% that someone would pass that. In terms of bringing in the midpoint testing, which we are doing now, the purpose behind that is to identify people who may be positive and pose a risk to anyone else around them, even within isolation. For instance, you can actually have someone who may pass a day 1 test because they haven't actually fully developed COVID yet. And they might have recovered by the time of the day 13 test, so we would never actually know they've had it. By doing a midpoint test, you potentially pick up those individuals and are able to put mitigation measures in place at that point. So the midpoint testing from an epidemiological point of view is very, very important.
Thank you, June. Your next
Okay.
question.
Thank you very much indeed. Now, obviously, it is going to take a little bit of time for businesses and people to prepare for this, but there will be those who are asking the question as to why it isn't coming in tonight. Maybe you could just clarify the reasoning behind why it has to be Wednesday into Thursday.
Well, I think we have to give businesses time to prepare rather than just saying, as of now, that's it, you're shut down. We are obviously asking take action